So, so what we will do is really to ask to raise hand, and then they will share the challenge before we get the slide. Because in fact, the session is really about sharing your challenge, and then Francois will deep dive into it and try to support you with it. And then if somebody has a comment on the challenge, they might want to add something. So I think Francois, we can definitely start. So the floor is
Yes,
yours to see if they can raise hand while
I
I'm
can.
trying to sort
I
out the
cannot
subject.
see raised hands on my screen. I don't see
Yeah,
the raised hands.
yeah,
I
I'm sorting it out. Now you will be able to see that.
maybe.
Um, right. Now you can see, but I will say good afternoon to everyone, good evening, depending where you're connecting from. So today's the lightning session with Francois Das and Charlotte Mbu. Charlotte is facing a kind of power off, so she's trying to reconnect while we want your section to start. So Francois is ready. So please go ahead and, as usual, raise your hand, and Francois will be happy to take your question. And yes, so
Yes.
welcome everyone.
Thank you, Alain, and welcome to everybody. I see someone coming, attending from Indonesia, so it must be very late in Indonesia, and that makes your commitment to that session. Happy to see you. We are now 31 participants on the call. You know, we are continuing those lightning session, and you know that this week was looking at defining very clearly your priority challenge and the cause of the challenge, making a priority, looking at the cause, defining an objective for your priority challenge, and identifying actions and action step to overcome the challenge you have selected among the many challenges that you check. So we had decided, I don't see the screen, the presentation yet, but we had worked out a little case study which I'm sure when you see the case study, you will say, oh, this is exactly what I face in my district or in my health facility, the problem due to COVID, which has impacted my coverage. It has decreased the coverage. It has, the dropout has increased, and I'm facing this problem. And in the case study, we will look at what are the several challenges and problems that this area face. And then you will have to respond to 3 questions that we're asking. Now, basically, we will open the floor, and people who wants to respond to the question will raise their hands, and we will hear your views about this problem and how to resolve it, how to select the priority issues, and what to do about it, and what would be your objective if you resolve this challenge. What objective do you intend to achieve by implementing solution, which means action, and the task you have to implement to resolve the action. As you know, when we say sensitization to of community leaders, this is a strategy. You need to know what action you will take to sensitize. What are the few actions you need to implement step by step in order to have all the community leaders sensitized, and sensitizing maybe the mothers and the community. So I'm not sure that we can have the shared screen from Charlotte anytime soon. So I could, maybe if you don't mind and you listen carefully, I will explain the case study with my memory, what we built. So basically, you are in charge of an area, and usually this time it was a district manager. He's looking at his data on coverage on the information system for APIs, the DHS2 or DHMIS, and he realized that when COVID came in, suddenly the coverage is dropping, and he sees a dropout moving from 10 to 25%. And he's very worried. So his first task was, we are on board. So you will see, I will be able to read, and you will. So the case study. So as I mentioned, the dropout, the coverage because of COVID. So he contacts his health facility staff and say, what is going on? And the health facility staff say mothers are not coming to the hospital and to immunization site because they're afraid to catching COVID-19. They say, we have been asked to stay home. And then there's too many people and we may catch in hospital, we may catch the disease. Other health facilities said vaccinators cannot go. The drop is because vaccinators don't go on outreach because they have no protective equipment for them. And they fear to be contaminated by the mothers, the communities. And other staff say, well, you know, there's been rumors in the social media and mothers are very doubtful about the vaccine. They think it's a COVID vaccine they're testing on Africans, and therefore they don't want to bring back the child to the immunization sites. Next slide. And in other health facility, even the nurse refused to do the immunization session because they think they're going to be contaminated by those mothers who come without mask and there is no social distancing and all those things. So basically, after hearing all the cause of the many problems, the district, the supervisor, the district chief decide we need to resolve the problem. And he meet all the health facility staff and he say, I want you to, you know, to restore the immunization performance as it was before COVID. And you should focus on increasing demand for immunization by women and mothers of targeted children. And you should do, you know, the outreach, you should do a catch up now. You've missed outreach, you have to do catch reach, and so you need to execute your outreach. Next one. So now the question, you've seen the problems, and when you look at a situation like this, you know, the fear of the mothers, the vaccinator not going in, the rumors going on, the health facility worker very nervous to organize session because they lack equipment. Could you respond? Could one of you attending the session respond to the three questions? What would be the priority challenge with what we have described, where you are positioned? What would be the priority challenge? You have to address all the challenge, but maybe one will carry more weight, and you need to be clear on which one will carry more weight to restore your immunization coverage and reduce your dropout. And you have to justify why would you choose that challenge among the 3 or 4 challenges. Why would you choose that one? And then if you choose one, what would be the goal to overcome that challenge that you have selected? And then you will need to list what idea, action, and action steps you would take to achieve your goal to overcome that challenge. So I will over to you, Charlotte, if you are available to talk, and we will ask for people to raise hands, and if they want to answer those questions with their own knowledge and observation in their own area.
All right, thank you very much, Francois, and thanks to Alain Blaise too for the technical support. And I'm finally very much relieved that I was able to join this evening. Had serious issues with my internet connection, but thank God everything is fine now. And I do hope we'll be able to go till the end of the session. Now I already see a hand that is very spelled AK. So I'll directly invite you to unmute yourself. You have listened to Francois share the case study. So over to you, Pearl. Hi, Pearl.
Hi.
Good evening.
Good evening.
Everybody from Ebonyi State. Hello?
Yes.
Hello?
Hello,
Can you hear me?
Yes, we are getting you, though there is a bit of background noise.
Okay. I say I am Pearl from Ebonyi State in Nigeria.
Okay, so pleased to
Hello?
meet you. Yes,
Okay.
we are getting you.
Okay, my priority challenge is how to maximize the quality of health education given to caregivers during immunization services. Because in this COVID-19 era, because of the restrictions and WHO guidelines distancing, that we don't keep mothers or caregivers waiting during immunization services. And that has negatively impacted the quality of immunization, the health education we render to them. And it has turned back to them reporting higher incidence of immunization reactions and other things that were normally addressed during immunization. There is higher incidence of immunization site infection. Like many of them come back this month alone. We've recorded more than 10 immunization site infection that women brought back their children, because as they come, we hurry them and give them immunization, just trying to wear the children, record and other routine things. The index quality time we allocate to health education for behavioral change and to address other things has really dropped and is affecting the general health of the populace. Because and now in COVID-19, we know that there is need for health education of the public on how to stay safe, how to avoid contacting the infection and what to do, which immunization services has always been one of the media through which we address this challenge. So that's one of the emerging challenge in my area now. Hello?
Yes.
Okay, yes, Bill. So, yes, Francois, please go ahead.
Okay, so my goal is to try to develop a strategy whereby we try to communicate this information as they come through recording those topics on audios, so that as they come as they are waiting, as their children are being wed, they also listen to these tapes. These health talks through tapes. It's no longer keeping a time, a schedule that someone is coming to do health education, waiting for the people to gather and the number to, like in my center, average number we have during immunization days has been between 500, 600 before COVID. Then, because then we do immunization Tuesdays and Thursdays only, and it's a whole day event from health education to nutrition education to other events that follow. We even campaigns are also included. But since COVID came, other activities have been sidelined that we face mainly vaccination and weighing of infants. So it's a challenge in our area because the rate of dropouts and the rate of non-compliance to scheduled immunization visits is everywhere. Many of them don't come. I think if health education could be intensified, if there is a way we can pass this information across repeatedly to them in the way they can understand, even the few hours or minutes they spend in the clinic, that it can help we can go a long way to save the situation.
Okay, well, thank you.
So that due to the new pattern of work, where initially nurses or health workers are positioned at different type, but now you have to put them, some to man hand washing, some to ensure that face masks are being worn, some to ensure that social distance are maintained. So the health workers are already overwhelmed, that coming to divide as they come to start to health educate them one by one or to group them into smaller units may not be very possible in my unit, that we have limited number of health workers, and to comply with the guidelines of WHO that said reduce gathering, reduce public life and waiting time. So I think if strategies can be put in place to ensure that as they come, tapes are being played in their hearing as they are entering the clinic, and throughout their stay, it will be running like jingles. And also to ensure that health education, immunization will be more effective as a way of strengthening them and giving them a blaze on the current health challenges we are facing on how to stay safe from contacting COVID-19. Hello?
Okay. Yeah, thank you very much, Pearl. I'm sure I have heard an idea today that I haven't heard before. Over to you, Francois. What do you think?
No, I thank you for presenting Eke in your challenge, and I understand your challenge that you know you face a very serious issue. You have a shortage of personnel. You have decided that health education was for you a priority because the rest was very difficult to address, but you saw that health education was the best. You say that maintaining, if I understood well, organizing, you know, a small group of vaccinators spraying over time was not really a solution. And I understand. And no, so your goal, I was not really 100% sure of your goal, but your goal is in fact that every mothers understand, all mothers, all communities understand what is COVID and how you can prevent it, and why immunization is important to come in, and that you are protecting the staff is now protected and from contaminating the mothers, so it's very safe for mothers to come. Now, what will be very important for you would be to be very clear on the action step you're going to do to make the health education. I'm not sure I fully understand your approach in practice to contact the whole communities and mothers. Can you clarify?
So Pearl, unfortunately, I'm not seeing her. She put down her hand. Okay, Pearl, so I'll be inviting you to unmute yourself. But one thing that caught my attention in in your sharing of your experience was the fact that you said pre-recording education, immunization education messages and playing them over and over to mothers at home. So please go ahead and answer the questions that Francois asked. Bill? Unfortunately, we are not getting you.
Please, can you ask the question again? I did not get the question right. Please, hello?
Okay.
Hello?
Yes, we are getting you now.
Okay,
Francois,
I did not understand. I did not get the question. Please.
How are you going to implement in practice? What are the actions for your health education that will help you to overcome the lack of information of communities, and what will be the message in those communication activities? How are you going to do it, and what will you
Just
tell?
as I pointed out, to pre-record education or health education audios and play over and over again during immunization services to ensure that they get the information wherever they are or wherever they enter the clinic. Two, to liaise with the Ministry of Health to run health education jingles on local radios and television stations for the populace using their local dialects and tongues over and over again, especially during prime time, so that they can hear it in their homes, they can hear it as they farm, they can hear it as they are in the market. Whenever they turn this radio station, they can understand and hear they need to come for immunization and all those education packages, health education packages we deliver during immunization services.
Okay, that's very clear now. Thank you very much, Eke.
And also to arrange special occasions. These reported cases we had were more common among new mothers who had little or no prior knowledge on the immunization of their children, what to do, how to take care of the immunization site and other things. So to arrange special occasions, as long as we take their history, you are coming for the first time, this is your first child, we arrange for home visits so that we send one of our officers or volunteer to visit you at home and give you more information on how to overcome or on those packages you could have done if we had more time and more distance in the clinic.
Thank you very much. Over to you, Charlotte.
okay, thank you, Eke. I see another hand raised, the hand of Abubakar Shuaibu. And there was a question, so I'll invite Abubakar to unmute himself. There was a question from I'm sure I already answered the question in the chat from that is, I just wanted to say he wanted to find out if we are answering the scenario that is projected, that has been shared, or a real challenge. So you can still answer your real challenge. The choice is yours. So over to you, Abubakar.
I'm Abubakar Shuaibu. Hello?
Yes,
Hello.
we are getting you.
Yeah, I'm Abubakar Shuaibu. My priority challenges here in Binungwari, we have insecurity, a low income, a low patronizing of the caregiver to health facility due to this COVID-19 pandemic. But all these are happening due to security and COVID-19 pandemic. So that is, we have low income to the community. Yeah?
Yeah, so go ahead.
What is the priority? Can you resolve the insecurity issue? Because insecurity was before COVID, so now it is aggravated by COVID. Or not?
Yes, now due to COVID-19, we have low participant in the health facility for immunization.
Yeah.
So that is my challenges now that I am facing in my health facility.
And what are you going to do about it?
Yeah,
What are the actions?
I'm trying to meet with the community leaders so that we discuss about this and that we can arrange so that I will follow them maybe house to house for vaccination as an outreach due to, because we have lockdown, many people as WHO give the guideline, stay safe, stay at home. So that's why people are understanding when they come to health facility, maybe there is more participants, more caregivers. So that's why some people refuse to come to the health facility. So I am trying to talk with the community leaders so that we can arrange how to meet those that are not coming, defaulters, so that we can treat them and vaccinate them. I think this is what I am going to.
But one clarification. At what level are you working? At the health facility level?
Yes, sir.
You are working at health facility level. My next question,
Yes.
do you have the protection equipment for your staff doing outreach? Or you're facing a problem with the protective equipment?
Yeah, we have them. I have them.
Okay. And your staff is really trained on the prevention, the control measure, you know, the distancing, the washing hands, the wearing mask. The staff are already, the health staff are fully aware.
Yes, sir.
They will have no hesitation to go to outreach. They will, if
you said,
will they be willing to carry out the outreach? So your problem is only the mothers to come when you go to outreach. It's mothers to come because okay. Now, if you go in house to house, do you think you will be able to reach the mothers by going house to house? What will be the critical action you will take to be sure that when you enter the house, the mother is not worried?
Yeah, I will go hand in hand with the community leaders.
Excellent. Yeah. Okay. And have you already started putting in place your idea, or is it on the plan? It's just a plan for the time being.
I have already started the plans as last week.
And what was the results? Are you making progress?
Not have more compliance. There are compliance now.
There is a compliance now. That's good. So you are on track to get better, a better coverage and resolve your problem. I think it's nice to see that you have understood your problem, the fear of the mothers due to the message, and that you solve it by going on outreach, well protected, and doing house to house in company of the community leaders, and you see already some positive change. So thank you very much.
Thank you, sir.
Okay, thank you, Francois. Thank you, Abubakar Shwaibu, for sharing this experience with us. And I do hope that you have finalized your project and will be ready next week to post it when the time is right. As we all know, as a reminder, this week was us starting to working on our project, and then we have up till next week, Friday, the 21st of August, to submit the first draft of the project. So I'm going to invite Abdullahi Balarabe. Abdullahi, if you're getting me, can you unmute yourself? You have the floor.
Hello, good evening, everyone.
Good evening.
My name is Abdullahi Balarabe from Katsina State, Nigeria.
Okay.
Where do you work? At what level?
At the state level. I work at the state level.
At the state level, like a national.
Yeah.
Okay, thank you. Go ahead. What's your priority challenge?
Abdullahi, what is your priority challenge?
Yeah, the major challenge we're facing at the state level was that the decreasing demand for immunization due to a lack of awareness on the side of even the clinic staff and the parents that are to bring their children for regular immunization session. They were scared of the pandemic on how they can actually protect themselves against the virus. But we were trying to make remarkable effort on that direction by distributing awareness leaflets in the local language, and also in the English. There is an English version of the message for those who understand English. So, and by going by that direction, we have begin to see a little bit improvements prior to what we have been experiencing at in different clinics during the regular immunization session. And also there are a lot of underserved areas due to security challenges. There are a lot of local governments that vaccination cannot adequately take place in such communities due to activities of bandits and uh, securities. Yeah. So what we are doing in that direction before we actually head to the clinic for regular immunization or outreach, we do normally communicate with the community leaders to ensure that everything is in order before we actually send our staff for immunization on that the same day. And then even the vehicle that will take our staff, we ensure that uh, that person is somebody that we used to work with, not just a stranger. So those are the kind of efforts we're making in that regard. And then in the next few weeks, we are trying to actually make like awareness, community awareness. We also will get to such communities to let them aware of the dangers of not coming to vaccinate their children against all these deadly disease, and then on how they can protect themselves.
Great, thank you.
Okay, thank you. Do you have any questions, Francois?
Ma?
You know, Abdullahi, thank you for sharing your experience. You are at state level. How did you manage to get those actions in place at the community level to inform mothers, and I know that security is very difficult, but how did you get the health worker to go on outreach? What was your action from a
Yeah,
state level
yeah,
position? Because you're not the one,
yeah.
you're
The
not the
base,
district. Hmm?
yeah, the basic action that were put in place was that for you to go to an outreach session, we get to actually call the community leaders. You call them on phone that was there any problem along the road or any, because whenever there's a security problem, there's a kind of platform that you can easily communicate. So when everything is in order, there's no reports of even in the neighboring communities, because we normally actually call the community leaders that we are specifically going to, and the neighboring communities, to ensure that that route is in safe heaven before you start going
But
for the outreach. And even the means of transportation, you cannot just we do normally hire a bike, a particular person that will be taking us on each and every regular or outreach station. So it's somebody we know. You cannot just use stranger, you know, transport down to such places. Those are
but
the kind of measures that we are taking in place.
a little question, Abdullah. This security issue is not since COVID. It existed before, or it has increased with COVID?
Yes, it has actually increased with COVID, because these bandits were able to understand that there's lack of movements of people from place to place, and then because most of these community people, local people, they are business people that they do go to market. And during this pandemic, they definitely know that people were at home. So when they get to such communities, they know they will meet people and they do whatever they like before the arrival of the security people. So it has actually increased.
This is quite great. So you are really adjusting to the situation by asking
Yeah,
and calling by phone community to say, are you
def,
safe? So we are coming. If there is a report,
definitely.
you postpone.
Yeah,
I think this is a
yeah,
very good
definitely.
strategy to address insecurity issue. And have you
Yeah,
communicated the strategy to all health facility? How did you convey that solutions? Did you develop
yeah.
little papers that you shared with all your this health facility, or how did you do that to convey the
eh,
message?
Definitely, there was actually plan on ground, and even on the side of the security people from the side of the state, they were actually making effort to curtail the incidents. We have seen remarkable improvement on that direction on the part of government, because they were using data to actually understand the trend of these activities of these bandits. Most of the attacks are normally on either early morning or in the late evening. So we're trying to use all this data to understand the activities of these bandits people. So most of the attacks is normally early morning and late evening. So definitely for somebody to reach to such communities, you will definitely not start going there very early and not late evening.
Okay. Thank you very much. This is quite an innovative approach to face security issues at the time of COVID. And I hope you will develop your project and you will put all the detail. You know, you need in your project to the detail of implementation, the task you will have to implement to make it work. I think it's very, very important. Thank you very much.
Thank you very much as well.
Okay, thank you. I would like to, though we are over time, but we know we had technical issues at the beginning. So just for today, I'll plead your indulgence for the extension of the time. We have Matthew Joker, your hand was raised. So if you're getting me, can you unmute yourself? And while you're doing so, there is this question that keeps coming up on how to submit the template. Francis Tay, I don't know if you downloaded your template only today, but the template has been available on the Learning.Foundation platform since Monday, the template for the project. So very soon, just be patient. By next week, you will know where and how you are going to submit the template. So Matthew Joker, if you're getting me, I'll invite you to unmute yourself. It's the same thing with Rohan J. So the first person to. Okay, so Rohan, you have the floor.
Thank you very much for giving me the floor. Well, I want to make some contribution with regards to the questions and also what my fellow scholars have raised in terms of, can you hear me?
Yes, we are getting you.
Okay, I said I just want to make some contribution with regards to the question that is being asked and also what the points that my fellow scholars have been sharing with regards to sensitization in creating demand for immunization, both from the caregivers and also health workers responding to deliver immunization services. Well, first of all, what I would like to say, some people raise the point that is the low awareness level, which I agree at some point. But what I want to emphasize more is most often, you know, when we try to create awareness or give messages to promote immunization, we tend to focus more on caregivers who are most of the time the women. But I think now we forgetting that those caregivers have super caregivers, you know, who are in charge of them and who are most of the time their husbands. So I think involving the men a lot in our sensitization will help a great deal in making sure that immunization services are being sought by these caregivers. Because come to think of it, the caregivers who are women, you know, are under the custody of these women. And for them to seek health care, they need this decision to come from their spouse, even the help, you know, when it's come to the economical support or financial support to get to these health facilities depend on them. You know, the decision generally comes from men. So briefly, what I just want to say is we try to involve men more, especially, you know, spouses and head of household. Involving religious leaders is a remarkable, you know, action that we are taking in making sure that the people get their own messengers who are living within them and who are their leaders, because they could better listen to those people. The second point I also wanted to emphasize is during a supportive supervision, I went to, you know, some of these health facilities, and I've seen that most of them are not practicing social distancing, you know, for these women who are coming to seek for immunization services. So one of the what they said, the health workers, you know, raised their concerns, and they said that they don't have enough space and they don't have enough maybe chairs to make sure that these women sit far apart, at least 2, you know, meters away, to observe the social distancing. So they said they don't know what to do. Well, what I suggest to them is, if at all that you are scheduling, you know, immunization services within the health facility for 2 days in a week or 3 days, make it 5 days in a week from Monday to Friday, so that if 20 women come in on Tuesday, you can further split it to 10 women coming in 2 days of the week. So when they come in your little space that you have, you could be able to arrange them in a way that they could, you know, have 2, you know, meters, you know, away from each other to observe social distancing. And also some of these women raise their concern that they are coming with their masks. But what do we do? What about their children that they are coming with? They are not wearing masks. So what do they do? And I think that has been something I have been thinking about personally, because come to think of it, you are bringing your child, you are wearing a mask, but then what do you do for this child? I think it's a concern that I would like also the panel and also fellow scholars to share, you know, more on that. Thank you very much. My name is Rohinjai and I'm connecting from Sokoto State, Nigeria.
Thank you very much. Charlotte?
Thank you very much, Rohe. You know, very interesting intervention. Francois, what's your take?
I think she raised very important something not to omit. I think she came very quickly to concrete actions, and she mentioned you know, sensitizing the men, the housekeeper, not just the caregiver, but also the men who are responsible for socio-economic situation for the mother to go, and even maybe some time to clear. The man needs to be sure that their wife and children will not be infected. So I think focusing on the man, and not just a woman, is very concrete activity, and I hope we will see how it's done in practice. What are the tasks you need to do? How are you going to do that? How are you going to convince them? What are the messages conveyed to the men? how are you going to meet them? Who is going to meet them? Because some people are influencers, some are not. The second was ensuring that the safety at the immunization site. And you mentioned that I think you put in place a very concrete activities to spray the sessions over 5 days instead of 3 days. I suppose you're not in town, because in town they're already overwhelmed. Even with 5 days, they have a problem. So, but if you're in rural areas, I'm sure it's a very good solution to increase the safetiness and the perception of safetiness. Now, you raise an issue about the young children. I think the young children, if the mother is protected, if the vaccinators are protected, we don't want to put on young child a little mask, because they need to breathe more than anybody else. But if everybody around, if you respect all the measures, I think the child have little risk to get the COVID. So it's not the risk zero does not exist, but if you don't immunize, the risk is far higher to get measles, and with the dramatic consequence of measles. But if you respect social distancing, the mask, the hand washing for the vaccinator, you are reducing to almost zero the risk for your young child. So those messages are very important for the parents and the care workers have to share. So thank you very much.
So thank you, Francois, and thank you, Rohe, for that intervention. Now I'm going to invite Matthew. Matthew, please do unmute yourself. And thanks for your patience.
Yeah, I'm called Matthew Joker from South Sudan. I work at the state level for WHO as the EPI officer. At the state level, we have EPI supervisors at the state level, at county level, and we also have partners that are implementing some of the projects at the county level. So my challenge is when the COVID-19 started in South Sudan, the first case in March, so everything was done because of the lockdown. We are not able to do anything. Even some of the staff are doing work from home, and even some of them are doing half day. So that one actually reduced the demand for EPI services to the children. So we get into problem because before we have plans of doing campaigns and even for PD, and we have some money that was given by Gavi for immunization practice training to the partners, but all this was done. So it brings a burden on the EPI services, whereby you see during this COVID-19, all mothers are not coming for the immunization, and when you go to the health facility, there's nothing. But as of now we plan that, okay, once we receive guidance from AFRO to continue immunization, we call a meeting with the partners. We call actually the meeting. After the meeting, we recommend that the immunization in practice training should continue in all the counties. Then after that, the sessions should be planned so that the outreaches can be implemented. But later on, although the training was done, still there's no work done. There's no outreach that was really done. So with this, we have come up with some of the what that yesterday we have a meeting with the partners, and we are also going to call a meeting with the community leaders. That's why at county level, the county directors and EPS supervisors to come to the state level, so that we can at least have a strong action point, so that we can be able to follow those action points. So we are now focusing to again restart outreach services so that the mothers can come. By doing that, we also recommend that during the immunization services, the mothers should be informed in advance so that they can, when they are coming, they have to come with knowledge of having face masks, and also once they reach the health facility, they should be given health education before the immunization, so that they can sit in distance, and also the health worker or the vaccinator should have at least face mask or a PPE so that he or she can be able to vaccinate the children. So those are the action points that is practical thing that we are now doing, and that this is what I'm also putting into my project.
Okay, so thank you very much. Yes, we got you well, Matthew, and thank you for sharing that. Francois, are there any questions from your end? Meanwhile, there is a comment from Abraham Amin Nano Teye on the Q&A that says, I also questioned the children wearing face masks, which I also found challenging. My answer was that caregivers must first protect themselves and make sure they do not leave the children to be touching things at the hospital, but always in the arm of the caregiver. Thank you, Abraham, for that. Over to you, Francois.
No, thank you, Abraham, for adding this point, very important point. I think you have to have around the child the maximum security. In the arms, the hands are washed by the health worker, to reduce any contact with anything for the child. Because if you have a mask, you cannot contaminate the child, both of the caregiver and the healthcare worker. So, and if he has hands washes, you reduce extremely the risk of contaminating the child, unless you don't respect all those control measures. I would say I do realize that the problem of outreach, and I think you have put in place some steps to make sure the women come back. I was wondering, have you started with those actions? Have you see results, or are you seeing still problems? And what are those problems? In spite of the action you have taken, maybe 20% of mothers still are not convinced and not coming. What have you faced as a challenge with your approach to try to resolve the problem of non-attendance?
Yeah, before we started training the immunization in practice, actually those problems are there. The mothers are not coming, but nowadays during our supportive supervision, we can see that there are good number of turn up by the mothers, and there's also this protective measures that is taken by the mothers and as well as the health workers. Although we are lacking some of these PPEs at the health facility, but at least it can be reserved for the vaccinators to at least because here most of the parents they use that local made face mask, but the other face mask that is medical is actually reserved for the health workers for doing their work. So those are the things that I've seen practically, and at least nowadays the turn-up is raising, and we are confident that by the end of this month, we are also requested that this month we are going to have PD. So in the countries where there's no this fragility budget from government, at least PD funding is going to be is already approved. So we are also going to at least conduct PD in other countries where a fragility funding is not provided to them.
Okay, thank you for this additional clarification or the additional challenge you may face and you are addressing now when there is not enough budget to get all the equipment you need. So thank you very much.
Thank you.
Okay, so thank you, Francois. Thank you, Matthew, for sharing your experience with us. I hope that all those in the room have been able to benefit from that. So we are virtually 30 minutes, that's 24 minutes exactly over the 30 minutes reglementary time that we are supposed to spend for this session. I would like to thank you all for your patience. I know that we have learned quite some new things and pertinent things from this session that will enable those who are working on their projects to bring some improvements based on the challenge that you are facing. So I want to thank Pearl AK from Nigeria. Today was really a day of presentations from Nigeria. We got 4 speakers from Nigeria today. We had Abubakar Shwaibu, we had Abdullahi Balarabe, and we have had Rohenje all the way from Nigeria that shared their experiences today. And we want to thank you to Matthew Joker And just to remind that our next session will be on Tuesday, next Tuesday, while it's 6 p.m. Geneva time. And if you're having any technical issues with navigating the platforms, I'll encourage you to attend the technical support sessions on Tuesdays to Fridays at 11 a.m. Geneva time with Dr. Alain Blaise Tatinku. And then just to remind you too that you take advantage of this weekend. Earlier on today, you received mails from REDA inviting you to submit the preliminary, the peer hop progress report. It's a type form. It's a form that you need to fill. Please do not hesitate to do so. I will just, I want to appeal to you to you may use the weekend to fill out that form and to submit it as soon as possible. And also by next week, do not worry if you have not submitted your report, your project. You have 5 days next week to work on that. That's from the 17th to the 21st of August. The latest day to submit the project will be on the 21st of August 2020. And so if you're still working on your project, please go ahead and finalize it. As from Monday, you'll get all the instructions on how to submit, how and where to submit your project. So do not worry about any of those. You know all of our platforms that are still available for communication, Telegram, the Telegram platform, the country groups, all of those are there for you to get all the support you need. So I just want to wish you all an excellent weekend. I want to thank Francois, Dr. Francois Gaz, for being there with us throughout this week and throughout all of these sessions, encouraging and giving advice, very useful advice on how you can improve upon your project. I do hope to see you all again first of all, on Monday for the COVID Peer Hub General Assembly, and then on Tuesday for our daily lightning sessions. Until then, I'll just wish you a pleasant weekend, and I say you stay COVID safe. Bye for now.
Bye-bye, and thank you, and good weekend to all.